What if forgetting someone's name wasn't just a senior moment? What if that story your mom repeated 3 times this week wasn't just old age, but an early warning sign? I know that's hard to hear, but here's the truth. Dementia doesn't begin overnight. It starts slowly, quietly, with signs we often ignore. And ignoring them? That could mean missing the chance to help our loved ones early. That's why in this video, we're breaking down the 10 earliest signs of dementia with real-life examples, scientific research, and practical solutions. This is not just a presentation. It's a guide for families, caregivers, and seniors who deserve clarity and compassion. And we're not guessing. Everything I'm sharing comes from peer-reviewed studies, trusted neurologists, and global health institutions. By the end of this video, you'll be able to say, I understand what's happening. I know what to do next. I'm not alone in this. So grab a notebook or just settle in with a cup of tea, because this is going to change how you see the early signs of dementia forever. We begin with one of the most important early signs of dementia, memory loss that disrupts daily life. Let's break this down very clearly, step by step. What does it really mean? It's normal to forget an appointment or a person's name sometimes. That happens to all of us. But memory loss linked to dementia is not normal aging. It's when you forget things so often or so deeply that it begins to affect your daily life. You forget important dates or events. You ask the same question again and again. You increasingly rely on notes, family members, or reminders for things you used to manage yourself. Clinical explanation. According to the Alzheimer's Association, this type of memory loss is often due to damage in the hippocampus, the area of the brain that helps us form and retrieve memories. This damage happens early in dementia and gradually spreads. How is this tested or diagnosed? Neurologists use various memory tests such as MMSE, Mini Mental State Examination, MoCA, Montreal Cognitive Assessment. In these tests, they might ask the person to remember a list of words, recall recent events, repeat a story, do basic math, or draw a clock. If someone struggles with this repeatedly, doctors may suggest brain imaging, like an MRI or CT scan, to rule out other conditions. Real-life examples. Let me give you some real-life examples. A woman forgets she already made lunch and starts cooking again. A man forgets the route to his favorite supermarket. A grandmother calls her daughter twice in 1 hour, asking the same thing. These may seem small, but when they happen frequently, they matter. Why is this sign so important? Because it's usually the first clear signal that something is wrong in the brain. A 2017 study by the Mayo Clinic showed that 80% of Alzheimer's patients reported memory-related problems in the first stage. Early recognition means early treatment, and early treatment means slowing down progression. What's the solution? There is no complete cure for dementia yet, but we can slow it down. Here's how. Use memory aids like notes or phone reminders. Keep mentally active. Puzzles, reading, learning new things. Socialize regularly. Loneliness can speed up memory loss. Exercise. Physical activity improves blood flow to the brain. Eat brain-friendly foods, like nuts, berries, and omega-3s. Visit your doctor regularly for memory screenings. What should seniors and their families do? If you're a senior and you've been forgetting things more than usual, don't panic, but also don't ignore it. If your memory loss feels different or others are noticing it, talk to your doctor. And if you're a family member or caregiver, be patient and gentle. Early support makes a big difference. Let's take a short break. Before we move on to the next sign, let's take a short break. Take a deep breath, get some water, stretch a little. Why is this break important? Because when we give our brain time to process, we retain it. The second early sign of dementia is having trouble with planning or solving problems. This is not just about forgetting. It's about thinking differently than you used to. 1. What does this sign mean? Seniors may begin to find it difficult to follow a recipe they've cooked for years, manage their bills, track expenses, or pay on time, concentrate on a task for long periods, solve simple issues like setting the microwave clock or organizing medications. It's not that they've forgotten how. It's that their brain can't organize the steps like it used to. 2. What's happening in the brain? In the early stages of dementia, particularly Alzheimer's disease, the brain's frontal lobe starts to shrink and function less efficiently. This part of the brain controls planning, organizing, decision-making, logical thinking. That's why even small tasks begin to feel overwhelming or confusing. 3. How do doctors evaluate this? Doctors may perform executive function tests, asking the patient to plan a simple activity, solve a basic problem or puzzle, organize items logically. For example, how would you prepare to go grocery shopping? If the person can't explain basic steps like making a list, getting transportation, bringing money, this may be a concern. 4. Real-life examples. Let's bring this to life. A grandfather who used to balance the family budget now gets confused by simple addition. A grandmother who managed all holiday events can't figure out what to do first. A senior starts skipping medication because organizing pills is too much. Again, these are not small issues when they keep happening. 5. Why is this dangerous? Planning and problem solving are core to independence. If a person loses this skill, they may make financial mistakes, forget medications, leave dangerous appliances on. In a 2020 study from Johns Hopkins University, seniors with early cognitive issues were 2.8 times more likely to make medical errors without supervision. 6. What can be done? There's no quick fix, but there are helpful strategies. Use checklists and planners. Use technology like reminders or pill organizers. Engage in brain training activities, strategy games, Sudoku, simple problem-solving puzzles. Get help from loved ones when making complex decisions. Most importantly, don't hide the problem. Talk to a doctor or specialist. Early help means better outcomes. 7. What should seniors do? If planning feels harder than it used to, if problem-solving makes you anxious or confused, don't be ashamed. Don't suffer alone. Many seniors experience this, but those who speak up early can get support, tools, and maintain their lifestyle much longer. Let's pause for a moment. Okay, my friend, another short break. Why do we keep doing this? Because your brain needs recovery time. Neuroscience tells us that when learning difficult or emotional content, like signs of... Let's talk about the third early warning sign of dementia: difficulty completing familiar tasks. This might sound simple, but it can deeply affect daily life. What does this mean? Everyone forgets a step now and then, but when a senior starts having trouble with tasks they've done for years, it's a warning sign. For example, struggling to use a TV remote, forgetting how to get to a regular place like church or the store, confusion while making a cup of tea, difficulty with operating a washing machine they've owned for years. It's not about memory alone, it's about processing steps and making connections. What's happening in the brain? This problem comes from changes in the parietal lobe and the hippocampus, both of which help the brain link memory with function. The brain can no longer organize familiar steps in the right order. A task like cook rice isn't just one thing. It's wash the rice, measure the water, turn on the stove, check the time. And if the brain breaks this chain, the task fails. Clinical evaluation. Doctors or psychologists often use functional task assessments, where they ask patients to make tea, follow multi-step instructions, use objects like phones or microwaves. If they skip steps, get frustrated quickly, or abandon the task, this indicates cognitive decline. Real-life examples. An uncle forgets how to send a message on a phone he's used for years. A grandmother asks for help operating her microwave, even though it hasn't changed. A man forgets how to play a card game he taught others. The key is change over time. If it used to be easy, but now it's confusing, pay attention. Why is this sign serious? Because these tasks are what give us independence. Losing this skill means seniors may become dependent too early. They may feel ashamed, hide the problem, or avoid people. They may forget safety steps like turning off the stove. A 2021 study by Stanford University found that seniors who struggled with routine tasks were 3.4 times more likely to enter assisted living within 2 years. That's how serious this sign can be. What can help? There are many strategies to support familiar task challenges. Step-by-step written instructions, visual cues or picture guides, repetition and routine, doing things at the same time every day, simplifying tasks like using automatic kettles or pill organizers, gentle assistance from family without taking over the task. Most importantly, seniors should feel supported, not judged. This encourages practice, not fear. What can seniors do? First, be kind to yourself. Forgetting how to do something doesn't mean you're broken. It just means your brain needs a little more structure. And early action helps the brain stay stronger for longer. Let's take a pause here. Take a sip of tea, stand up, take a breath.
And a full breath out. Great work. Now let's breathe in and try and just fill up our chest. So on your inhale, just fill up the chest. Exhale, release. Again, inhale into the chest. Exhale, release.